I'll start recording now, and I'll turn this off. I'll turn the screen share on. Okay, so we are here, and I'll put the chat so we can see questions. Let me get this out of the way. Okay. So what was the question? N is strategy to make a rough count of sentences. Well, you don't really need to make a rough count of sentences. You need to make a rough count of words. So what I recommend when you are practicing, practice on lined A4 paper. Yeah. Now, most people write between 8 to 12 words in a sentence, well, on a line. So what you need to do is when you are practicing, because you've got to leave a space between a paragraph. So if you are practicing on lined A4, 200 words, you're probably going to be aiming at one side of A4. If it's any more, that's probably too many words. So you need to work out how many words you usually write on a line and do a calculation accordingly. Yeah, that's what I would do. That's what I recommend for people taking other examinations, such as the IELTS test, etc. You know, instead of wasting time counting your words, if in your practice you have a good idea of, you know, how many words you used to write in a line, and you'll get used to what 200-ish words looks like on paper. So you don't have to be counting. Okay, so we did the first 6 letters this morning, and I think we didn't start yet. We just reached this number 7. Now, something tells me we're not going to get through all these letters. You know, don't think so. I'll see what we can do, but I don't think we'll be able to get through all of these. I've got a class in 50 minutes time, and I've got to get downstairs, get into school. So we'll see how it goes. So, writing to refer Mr. Foster. Refer Mr. Foster to whom or to what? 22-year-old man, okay, who is known to have asthma, or is known to have had. Now, right. Why would you put this information at the start? 3 years of age. Shouldn't that be in the medical and social history section? You know, so I don't know if we would have that. And if that's Mr. Foster, that should be a capital F. 22-year-old man. You don't need these dashes or hyphens. Who is known to have well, have had, make it present perfect, since 3 years of age. Now, I wouldn't include that in this introduction, but if you must, make it present perfect. Have had since 3 years of age, which is uncontrolled recently. Your kind of management and care would be highly appreciated. So we've got 4 clauses in a single sentence. It's a bit complicated. So we've got a relative clause. We've got 2 relative clauses in the sentence. So that's non-defining. We could take it out, which is uncontrolled recently. Your kind management and care. Well, the task doesn't ask for management and care, does it? I thought it wanted further management and lung, what was it? Lung function test and advice. That's what they want. So management and care, okay, that's, you know, that sounds nice, but what you really want the reader of this letter to do is to give a lung function test and to give advice on management. So that's not quite what the task is asking you to do. Again, make it capital. Mr. Foster known case. Well, right. So we need some kind of verb here. So auxiliary verb. So either Mr. Foster is a known case. I mean, and again, we know this. You have mentioned it in the introduction. So why have you said it twice? So that aside, in grammar terms, so it would either be is a known a case or has a known case, but we need an auxiliary verb and an article. Is a known case of asthma, and for which he's of ventilator. Also, he has an allergy for cats and has a family history of asthma. So again, we've said that once, and I don't know if we really need this information here. So initially, capitalize, Mr. Foster was into my clinic, complaining of shortness of breath while sports activity. Again, we need some kind of a verb here, while participating in sports or while doing sports. We need something. We need some kind of verb. Shortness of breath while playing sports. Furthermore, wheezing and coughing disturbed his sleep at night. Why wouldn't you just make that a part of a sentence? You know, complaining of shortness of breath while playing sports, as well as disturbed asleep due to wheezing and coughing, or something such as that. And what is this? In addition to increasing, using? Well, if you've got a verb here, right, this would have to be an adverb to increasingly using, or to increasing his usage of medication. So we wouldn't just use it like that. We would have to either say, make it an adverb, increasingly using, and in addition to what? So increasingly using his medication is in addition to his symptoms. It's not so clear what this is in addition to. In addition to increasingly using, or increasing his usage of medication to relieve his symptoms. Why do we have a comma? Why for the last 3 weeks? That's part of a sentence. And why do we have a comma and a full stop? And why do we not have a capital at the start of the sentence? He also complain, or what? So if it's third person S verb, it should be he also complains. He's complaining now, but because it's in the past, we would make that a past tense verb. He also complained of heartburn after eating. He was not sure about his medication time. Well, so we need some kind of conjunction. He also complained of heartburn after eating, and he was not sure, or something else, right? So we need something. You can't just have he was not sure as a subordinate clause. That doesn't work. CXR and FBE were ordered. Okay, right now. Usually, you spell out the acronym first, and then afterwards you can use it. Yeah, so you would spell out what CXR and FBE and GORD, and then you would put the abbreviation in brackets, and every subsequent usage you can just put the abbreviation. So were ordered. He advised himself to quit smoking. He was advised, or I advised him, if you want to make it active instead of passive. So he was advised to quit smoking. God was prescribed. Appointment arranged after 1 week. What? An appointment was arranged after 1 week for review. Got to watch the grammar. There's a lot of grammatical mistakes, and this is only the second paragraph. On today's visit, no modification of his lifestyle or medication compliance were noticed. Chest x-ray, well, his chest x-ray, why isn't this part of a sentence? Why is this a separate sentence? You could put this into that sentence. No modification of his lifestyle medication compliant were noticed. Also, his chest x-ray was clear, and his chest x-ray, also FBE shows normal results. Recommendation, why are you beginning a sentence with a noun? Recommendation to continue was given. A recommendation, or I recommended, but that's not a complete sentence. What they want is, as the task says, complete sentences. For more 7 days was given. The advice to follow up with me. All right. Recommendation to continue for 7 more days was given. The advice to follow up with me. To follow up with you about what? Counselling regarding how to deal with missing dose was done. What is this? Too much passive here. Too much passive, and it doesn't work. It's far too long. Complicated. Recommendation to. So I recommended that he continue for 7 more days. I don't know what the advice to follow up with me. I don't know what that means. Also, I counselled him regarding his medication, and I also recommended that he quit smoking. If you made that sentence active, it would be much easier to read, because how that reads now, it's not very clear at all. In light of the above information, please evaluate Mr. Foster's, where are we? Come here. Capitalize. Mr. Foster's possessive situation. Any query, please not hesitate to contact me. Okay. Now, I don't know if you can hear. Can you hear the construction sounds? Can you hear that? 2:35, a little bit long. Can you hear that background sound? Construction? If you can, somebody tell me, can you hear it? Because I can hear it. No, you can't hear it. You can't hear this. This. I'm talking about this. You can hear it. That's a bit annoying. We'll see how that goes. Because most people in the office building have left, so they can start with their construction work. I'm still here till 7:30, so everybody else has gone, so they think the building's empty, so that's when they start their building work. But it's not empty, not entirely. Anyway, that's not so good, but well, listen, it's annoying me, right? So let's have a look. What's this next one here? So, Zach Foster. Why is this uncapitalized? And why do you put, you don't need that dot. Mr. Foster. Who is Anne? So why are you using present simple? And why are you saying for the last 19 years? Okay, so it would have to be present perfect, who has been. It's been patient for the last 19 years. and had witnessed aggravation. He's a witness? Well, he's not a witness, is he? He's experiencing it. It's something that he is experiencing. So I don't know he witnessed anything. So unmet patient last 19 years and had, and his condition has aggravated over the last 3 weeks. I think that's possibly better. Make aggravation aggravated. So I would probably make it put in the relative pronoun. So I would probably do it something like this: and whose condition has been, if you want to use that word, aggravated over the last 3 weeks. Or you could say has worsened. And if you're going to do it, don't write free, write it as a word. So I would probably say whose condition has been aggravated or whose condition has worsened. That's good. Okay. Had been, right. Had been past perfect means that he stopped. He hasn't stopped. So why is it past perfect? Has been, present perfect, indefinite time. Has been a heavy smoker for the last 4 years. He suffers exertional, or he suffers from exertional dyspnea, as well as a nocturnal cough and wheezes or wheezing. Nocturnal cough, and yeah, I'll probably make it wheezing because it's an activity, which is increases Ventolin consumption. Yeah, that's good. He complained, well, you complain of postprandial epigastric pain, which is diagnosed as a gastroesophageal reflux disease. It could be triggered by asthma. Examination, he was medical and was commenced, and he was commenced because if you don't put he, this could refer to his examination because that's the object. Well, that's the object. His examination was unremarkable, and he was commenced the proton pump inhibitor. And advice to commit to the inhaler, as well as the cessation or simply cessation of smoking, stopping smoking. On Mr. Foster's last visit, he stated that he did not quit, or he had not stopped. He stated, or he said, I don't know, he stated that he had not quit smoking, nor did he commit, or nor had he committed, nor did he commit, no, that was good, to his steroid inhaler. Fortunately, it's just, why do you have these commas? You don't need them. Fortunately, so you can have one there, but we don't need one here. Fortunately, his chest X-ray as well as his blood test, were normal. Well, we've got two there. His chest X-ray as well as his blood test were normal. He was offered some useful methods to stop smoking. He was advised to continue to commit to his inhaler. Your kind care for lung function. Kind care? What? So if you don't tell him to be kind, he might be unkind. Doesn't make sense, you don't need this kind of stuff. Your kind care, what? So if you didn't ask me to give my kind care, I might give my unkind care. So, and it's not care. They want a lung function test. That's what it says. So you want to ask him, and in the introduction, you don't say what you want him to do. You want him, I think it's a him, Dr. Williams, yeah. You want him to do a lung function test. That's what you want. That's what it says in the task. So you've got to do it. For further management, refer for lung function test and advice about asthma management. So that should be in your introduction. What is it you want Dr. Williams to actually do? You want him to check his lung function and give him advice, not to simply see him. There's particular things that you want him to do. Make sure that you include those things. Your kind care for lung function by advice. Okay, now, so here, okay, that's good. And again, why do you put highly appreciated? He's not doing you a personal favor. He's doing his job. So there's no need for highly, greatly, kindly. He will do it in any case because that's what he gets paid for. Okay, so bit of grammar, grammar, but not too bad. Okay, let's move on, because I want to get through as many of these as I can. Mr. Foster, 23-year-old single male. Well, Mr. We can guess he's a male. 23. You can put the age if you want, but we can see it. He's single. That is relevant because, okay, your management would be appreciated. Well, yes, but it wants lung function test. I thought that's what it said in the task, lung function test, Okay. Was diagnosed with asthma since. Right, if it's simple past, was diagnosed with asthma when he was 3 years old, for which since, we usually use the adverbs for and since with present perfect or present perfect continuous, right? Has been, yeah? But because it's the simple past in passive, was diagnosed with asthma when he was 3 years old. So you've got to watch simple past and present and perfect. Okay. So Mr. Foster was diagnosed when he was 3 years old, which was around there. Can you notice electric cats and hay fever? His sister is known to be asthmatic. That short sentence, it needs to be connected to the previous one. Because if it's not, it's very short and it looks like a note form, and they don't like notes. They don't. What do they say? What does it say in the task? Do not use note form. Expand the notes into complete sentences. So, don't want these very short sentences. His sister is known to be asthmatic. Okay, so as I was talking about this afternoon, was it this morning? No, this morning, in fact. I would possibly put this a bit farther down. Because the main medical issue is coughing. He's not stopped his smoking. He needs his lung function assessment. So I would possibly put that as the main medical issue, and maybe put, this a little bit farther down for background information. He was presented. 10 minutes. All right. Okay. He was presented. Why is it passive? He presented. We have shots of breath. Wheeze and cough. Wheeze and cough. Wheezing and coughing. Again. Wheezing and coughing. And why is it separated by a comma when you've got and? Why just say, simply wheezing and coughing? Now, within shortage of breath, wheezing and coughing, the symptoms of which were severe to the extent that had been waking, that he had been waking, or that he had been kept awake. Were severe to the extent that he had been waking or being kept awake or been waking up during the night. He reported that he had been merely compliant. What is merely? And again, we don't use that word much now. Adherent on the inhaler. Merely adherent, you mean? But I thought the note said that he hadn't been adherent. So why do we have this as an adverb? Okay. However, on the examination, chest was clear, addition to the above, in experiencing good symptoms. I thought it was God. Which is, so again, when you're introducing that, you know, you need to spell it out. And I would have probably put that in the introduction like some of the others did. And then use an acronym. Today's visit checks chest XR. If it looks too much like note form, that's not what they want. We don't want it. His chest X-ray reveals clear chest, or A, clear chest, and FBA is normal. Moreover, however, is better. He's still smoking. Despite being educated about smoking cessation, he was still non-compliant or non-adherent on medications. GERD symptoms have improved. Why is short sentences? His, he was advised, he asked. You could put this, you could join this into a couple of sentences. Non-compliant is GERD. Symptoms have improved with quit smoking, with different strategies, has to continue on medication. Also, he asked, and to take the Pulmicort missed a dose. What does this mean? Well, I know what it means in the notes, but I'm not sure what you are trying to say here. And to take the missed dose of Pulmicort as soon as he remembered something, and to take the word order of Pul. I don't know if I've spelled that right. What's your word order? In view of the above, for management assessment of his lung functions, can they contact me for any queries? Okay. So there's a few things there. We've got some short sentences. You need to spell out the acronyms first, avoid the jargon. I would have watched that introduction. What is it you want him to do? You know? So watch use of adverbs for and since, some short sentences, some word order. There's a few things there. Okay, so somebody's got a question. What's this question? Adherent with, well, adherent to. You don't say adherent with. His adherence to the prescribed medications was questionable. Well, you could do, but it's rather a long-winded way of saying that adherence is a verb. Adherent. Adherent is usually an adjective. So adherence. So his adherence to, no, so you could say his adherence to the prescribed medications was questionable. It's a, as I say, it's a rather long-winded way of saying he was not adhering to his medication. So, I mean, it's, you know, the English part's good, it's just a little bit long-winded. So, adherence, adherent. Okay, I've only got 4 minutes left, then I'll have to get off because I've got to get down stairs to my other class, and this noise of construction is quite annoying. Maybe not to you, but it's annoying me. So I'll have to leave it at that. So does anybody have any questions? Anybody want to come in now? We've only got 4 minutes or so. If you want to raise your hand, I'll turn your microphone on. If anybody's got any questions, if you want to raise your hand, I'll turn your mic on. Anybody got any questions? Okay. Hello.
Hi, Calvin.
Hello.
And everyone.
How's it going?
I've got a request, not a question to make.
Mm-hmm.
Yeah, I was wondering whether it could be possible that sometimes you share the writing tasks for the nurses as well, including the speaking?
Well, that's not up to me really. I'd get in touch with Joseph.
Okay.
He's in charge of that. You know, I mean, I'm sure that if you were to ask, I can't see any reason why we can't.
Okay, thank you so much.
No, we can do it if there's a few people, you know, if there are several nurses amongst you, we can do that, of course.
Yeah.
If you just I just send a message to Joseph, and he can probably maybe post a writing task for nurses, and we can take a look at that too.
Yeah,
of course.
That could be highly appreciated.
Yeah, sure. I think Joseph's here, so he's probably heard. Yeah. So,
okay, thank you.
If you've heard that, Joe, that's something to consider for the future. Right, so Diana, was it you who had your hand up? Or was it somebody else? Hello?
Hello?
Was it you who was
Hello, Mr. Kevin?
Hello.
Okay. Hello?
Yes, we can hear you.
Okay, Mr. Kevin, I have a small questions for you. If you are going to write my letter, what's going to be?
What? Which one's yours?
The last one.
Do you want me to say that aloud in front of everybody?
Okay, I accept it.
Well, there's a lot of grammar mistakes. There's quite, you know, there's too many grammar mistakes here for the B. You know, and you haven't, you know, there's a task, as I've said, you haven't really said what you want them to do. You know, the secondary stuff, okay, you could put it like here, but there's a lot of grammar, there's some vocab, there's some word order. I think you would be struggling for a B, to be frank. As it stands now, you would be struggling for a B. With a bit of practice and attention to articles, simple past, present perfect, you could eliminate most of the grammatical mistakes. So that would certainly be an advantage. That's something I would have a look at.
I have to say
we can maybe have a session on grammar at another time, but there's too many grammatical mistakes. You are allowed some, it doesn't have to be perfect, but the amount that we have here, you might be struggling. Okay, now we're almost out of time, so I'll be on Telegram for a while. This is going to stop anytime soon, so I'll share the file in Easy Classroom and I'll post this video. I don't know if it will sound good because the construction sound, I could hear it, so I don't know if you could, but anyway, I shall do that. So this is going to turn off anytime soon, so I'll see you back in Telegram.